Navigating all the symptoms was really frustrating because you don't know what's going on, and you also feel like it's in my head or something. Stomach pain, fatigue, stuff like that. It's like so hard. You keep going to the doctors and they're like, oh, well, you have asthma, so maybe you're not getting enough oxygen to your brain, or we think you have a stomach ulcer, also we can't find it. In 2019, I started losing my vision in my right eye. You don't just go blind in one eye for no reason. So that's when doctors start to take it seriously. But getting a diagnosis is like a long journey.
The term inflammatory bowel disease actually refers to a group of disorders. So the two main classes are Crohn's disease, which can affect anywhere from gum to bone, and ulcerative colitis, which is just affects the colon itself. People mistake irritable bowel syndrome, IBS, as inflammatory bowel disease, IBD. Irritable bowel syndrome is your bowel is a little bit more hypersensitive or irritable, but there's no damage. A person can have both, but they're completely different.
I was so relieved to finally have an answer and just be able to be like, now I can do something about it. The inflammation, sure, it's anywhere in your digestive system, but it can get into your blood. And so that's why it's like a full body experience that's 24/7. There's down days where you're actually in a flare, just the weakest you can possibly imagine, and the most hard work to get your body to do anything. But then in between those days when you're in remission, there's so much to deal with. You're not like absorbing nutrients and like still dealing with fatigue from medications. Unfortunately, when you're admitted to the hospital and it's bad enough, they can't really give you the standard drugs that you're going to be on long term because it's so bad. They need to like put that fire out very quickly.
So it can be challenging to try to find the right treatment for the patient at the right time. For example, in Taylor's case, when I met her, she had been having potential side effects of her medication.
About a year ago, like my arms started going numb. I was getting confused, tons of memory loss, and my medication was giving me brain lesions. And we've had to try different things and see what works. And the conversation, these are the options, these are these side effects, and it's a whole discussion. When you're feeling so hopeless, it's really nice to have those doctors like encouraging you, and being in the hospital is such a mental roller coaster too. In the past, I felt like people don't believe me, or it's just not worth it for them to keep me in the hospital. Mount Sinai has a great just GI floor, which is really special because the patients understand what each other are going through, and I have not felt so cared for in any hospital in Canada.
The Sinai Health Center for Inflammatory Bowel Disease is one of the largest centers in Canada and probably in North America. We have 9 gastroenterologists who specialize in inflammatory bowel disease, and also 3 colorectal surgeons who specialize in surgery for IBD. Our group is very multidisciplinary. This is a very unique clinical program. We have the expertise. We are very comfortable with kind of thinking outside the box. We have a patient support group, and there are buddy systems. And so we try to connect patients that way for medication experience or surgical experience. I was diagnosed with inflammatory bowel disease at the age of 18. I think it helps me understand their fears and their challenges and help them open up more so that we can understand what their goals are.
My husband and I have been together 14 years, and we both wanted kids for a while, and then kind of got to the point where it's like, I don't think I can raise a child the way I would want to. Your energy is, first of all, not there enough to do so many things in your life.
Active IBD in the preconception time and during pregnancy is associated with like reduced fertility. And so our job is to try to find them the right medication that will be safe to use, but also keep their disease in remission. And for example, in Taylor's situation, she did indicate she was not family planning or considering that at the time. So that does open up a few options of medications.
When I'm doing well, I look at all my auditions that I gotta do, and like I'm at the point where a 9 to 5 isn't really feasible. So doing self-tapes at home is so magical. I feel really privileged that I've been able to make acting my career. I'm really big into cooking, and I get to create like something interesting and cool, and I'm so lucky to have such a supportive partner who gets it. And my husband and I are huge baseball fans. That's like my happy place.
I find it very encouraging now to see the explosion of research that's happened in the last couple of years. Just exciting and fascinating, because I really think that Sinai is going to be the place that will find the prevention and the cure for IBD.
A cure would be so helpful to so many people. It'd be nice to feel better and be able to do everything I know I can do.
Our Sinai IBD Center has been supported over the years by many donors, for which we are completely thankful for, because we would not be able to give the care to so many patients, to do the research that we do without that support.
I just hope people donate.